This medication is used to treat ear infections in children who have a tube in their ears. It contains ciprofloxacin, which is an antibiotic, and fluocinolone, which is a corticosteroid. It works by stopping the growth of bacteria and reducing ear inflammation and discomfort. It's important to note that this medication only treats bacterial ear infections and will not work for other types of ear infections. Using this antibiotic when it's not needed can cause it to not work for future infections. The recommended dosage and timing for Otovel Vial should be prescribed by a healthcare professional. Before giving Otovel Vial to your child, make sure to read the patient information leaflet from the pharmacist. Use this medication in the infected ear as directed by the doctor, usually twice daily, every 12 hours. Make sure to only use it in the ear and not in the eyes. To ensure the right amount of medication is given, and to avoid touching the ear with the dropper, a parent or caregiver should give the drops if possible. Hold the container in your hand for 1 to 2 minutes to warm it and lower the risk of dizziness. To apply the ear drops, wash your hands first and avoid touching the dropper tip or letting it touch the ear or any other surface. Have your child lie on their side or tilt the affected ear upward. Hold the dropper directly over the ear, and place all of the solution from one single-dose vial into the ear canal. Gently press on the part of the ear called the tragus 4 times to help the drops roll into the ear. Keep the head tilted for about 1 minute, or insert a soft cotton plug if directed. If directed to use this medication in both ears, repeat these steps for the other ear using a new single-dose vial. Use a new single-dose vial for each dose. For the best effect, use this medication at evenly spaced times. Use it at the same times every day to help you remember. Continue giving this medication for the full time prescribed, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your child's condition lasts or gets worse after 7 days, be sure to contact the doctor. When using Otovel Vial, it's important to remember that it has been prescribed by a doctor because the benefits for your child outweigh the potential side effects. However, prolonged or repeated use of this medication may lead to a new fungal ear infection, so be sure to follow the prescribed duration. If you notice new or worsening symptoms, contact your doctor. While it's rare, a very serious allergic reaction to this drug can occur. If you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you experience any other effects, be sure to contact your doctor or pharmacist. As always, it's best to consult your doctor for medical advice about any potential side effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before giving your child Otovel Vial, make sure to inform the doctor or pharmacist about any allergies your child may have to quinolone antibiotics or corticosteroids. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to talk to the pharmacist for more details. Also, inform the doctor or pharmacist about your child's medical history, especially if they have had an ear infection caused by a virus or fungus. If your child is pregnant, Otovel Vial should only be used when clearly needed, so it's important to discuss the risks and benefits with the doctor. It is also unknown if this medication passes into breast milk, so consulting the doctor before breastfeeding is necessary. Remember to always follow the doctor's instructions and dosage recommendations for the best results. When taking Otovel Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products your child uses, including prescription and non-prescription drugs, as well as herbal products, and share this information with your child's doctor and pharmacist. It's crucial to never start, stop, or change the dosage of any medications without first consulting with your child's doctor. This will help ensure the safety and effectiveness of Otovel Vial for your child. Always follow the doctor's instructions for the correct dosage and timing of the medication, and never make any changes without their approval. Please note that Otovel Vial should not be ingested as it can be harmful if swallowed. If someone has overdosed on this medication and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911. Alternatively, you can also contact your local poison control center for further assistance. In the US, you can call 1-800-222-1222, and in Canada, residents can call their provincial poison control center for guidance. It is important to keep Otovel Vial out of reach of children and pets to prevent accidental ingestion. Always store the medication in a secure location. If you have any concerns about the safe usage of Otovel Vial, consult with your healthcare provider for personalized advice. Remember to always follow the recommended dosage and timing as prescribed by your doctor for the best results. Remember, it's important not to share this medication with others. Otovel Vial has been prescribed specifically for your child's current condition, so do not use it later for another infection unless the doctor advises you to. It's crucial to keep the infected ears clean and dry, so try to avoid getting them wet when bathing and refrain from swimming unless your doctor says it's okay. Always follow your doctor's instructions for the best results. If a dose of Otovel Vial is missed, it should be given as soon as remembered. However, if it is close to the time of the next scheduled dose, the missed dose should be skipped. Do not double the dose to make up for the missed one. It is important to give the next dose at the regular time as prescribed. When it comes to storing Otovel Vial, it's important to keep it at room temperature in the original pouch to protect it from light and moisture. Once you open the pouch, make sure to use any unused vials within 7 days and then discard them. It's crucial to not open a vial until you're ready to use it, and to discard each vial after use. And, as with all medications, it's important to keep Otovel Vial away from children and pets. And when it comes to getting rid of Otovel Vial, it's important to not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. If you're not sure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.